Everyone's in their groups. They have at least 2 people. How's everybody doing? Good. Any feedback from last time before we start? Hey, good. You did your homework. You did your homework. That was the homework. Are you going to go?
I am. Oh, yeah, I guess I should have done that. I am. It's actually on break in April, and it's in Georgia, and I'm from Georgia, so I'm going to go on.
Hey, good.
The Global Health and Humanitarian Conference.
Global Health and Humanitarian Conference. Cool. Good job. Nobody else did your homework. Oh, no. Failure. Bad start. You don't get your financial aid. Okay, well, hey, there's your first question. Cool. Feedback. All I've heard is good job, which is kind of nice, makes me feel a little better, but isn't all that helpful. So one of the themes of NWB is constantly self-evaluating so that you get better. So I'm more of a critic on my own. So, that first one's kind of introductory, is kind of getting a feel for where you want to go and a little bit on how you want to do it. But it wasn't all that instructional, so I wanted the future talks to have some more meat with them. I've got a better recording set up this time. We're starting earlier, and I'll try to belabor the points a little less. I'll try to move a little faster, which is kind of necessary because the third session, there we go, we have Nigeria. Nigerian leader is back. The third session we aren't going to be able to do because Dr. Guy will be out of town, and I will be out of the country for a while. So we're cramming marketing into here, so this is like 1.5 classes. So let's get going. You all have your last week little mock nonprofit examples. So think about some attributes. This was also part of the homework. From those other models we talked about, partners in health with the extensive community health model. We talked about a more volunteer-based model with Outreach 360, which used to be called Orphanage Outreach, and then a more straight up serving other NGOs and trying to have a more grassroots kind of campaign with meds and foods for kids. So think about that. So here's some different aspects, and I think next week Christian is doing a brief meeting about some of these different kind of trendy things going on in global health now, many of which have been tested and are shown to be successful, and some of which are currently being tested, and we'll see how they pan out. So community health workers, volunteers, how much focus should you have on volunteers? Maybe you don't want any, you just don't want to deal with doing all the orientation and the paperwork, and you really just want long-term in-country people building your brand. Maybe you want a lot of volunteers. And then what educational level do you want? Just naturopathic students? Do you just want doctors and you're training doctors? High school students? Variety of options here. This little mark here is an attempt at a continuum between joining a current NGO versus making your own NGO. I would encourage you to, wherever you're going, deeply research all of the other things that are going on there and see if you can add onto it, add a naturopathic angle onto it. It's a lot easier to do that than your own startup. Do you want to charge for your services? Maybe, maybe not. So if you are free, you're more accessible. You might get too much, though. You might get some freeloaders who abuse it. I will say that is actually not too common from our work in Mexico and Haiti. But on the other hand, you might be pissing off local doctors, because now if people don't have to pay and they see the white doctor, why would they go see the local doctor who doesn't have the special training? And they must be better because they're flying in to do this, right? Sometimes that's the thought. So nominal fee might not really turn people off, but it might make you a better ally in the community. Something to think about. I'm not saying one's right or wrong. And then how much straight health focus do you want to do versus a more development focus? So say you get there, you're doing great medicine and everything, but you notice everybody's starving. There's that pesky food problem. how can you do naturopathic medicine when people are starving? Right? Food is medicine. You don't have food, you're starving, and you don't have medicine. So think about how much you want to actually tackle that problem. Maybe like Meds and Foods for Kids, there's already a program in your area that's doing it, and you just connect, boom, and you're handing out Plumpy Nut. Or maybe you need to have an organization come down and help you build sustainable farming system or something like that. So just think about that. Discuss for like 2 minutes in your group. You don't have to come to any hard and fast decisions. The idea with these groups is just to have a process of just starting to think about this stuff. I think having like 2 to 3 minutes to talk to each other and bounce ideas about what you'd like to do is more valuable than me throwing up more slides and talking. So have at it, 2 to 3 minutes. And you're not being graded, honestly. Everybody have some decent ideas so far? Yeah, I heard sliding scale. I like sliding scale. You gotta have someone in country that you can trust to know if someone's telling the truth.
Yeah.
Which you should have anyway. You should have some fixers. What else did you talk about? Own NGO, joining up?
We didn't actually talk about that.
Not sure.
But I would probably, since it's a mobile clinic, if there's a local NGO, see what they're doing and maybe team up. If there's not, then do this for themselves.
Cool.
Well, as I would utilize volunteers and do a lot of education for them, because who knows, they might be joining you or replacing you at some clinics that you may have started along the way. And charging them to come when they volunteer, making a fee for them to come volunteer with you plus for-fund donations. So therefore you can give healthcare for free in the places that that you can.
Sure.
And charging a nominal fee in places if you have a low budget and you need to save money. So that's the sliding scale question.
So sliding scale,
If needed.
but try to fund most of your care by volunteers.
Yes.
Plus grants and other
Yeah.
stuff that we're not talking about yet. We're getting there. Health workers are really good too.
Yeah.
Because when you leave your one spot, they can keep working and doing basic care.
Mm-hmm.
And then when you come, you can see the people who have more like complicated things. All plugs in.
In your
Sarah.
opinion, what are kind of the pros and cons of joining up with an NGO versus not?
One pro is getting the recognition because like the model working with the government NGO in the CAP area, at least in my opinion, is called Convit Santé, and they're supporting the local hospital. It took them 3 years to get their nonprofit paperwork through Haiti. So already having that can really help, because with supply chain, that means that they're set up through customs, people don't give them a hassle. Another NGO, we had a lot of trouble bringing in a truck with Mama Baby Haiti, because we didn't have any kind of official government help to expedite things. We had to deal with shady customs people and stuff like that. So cons, you need to know about the reputation as much as you can before you sign up, because they might be doing really harmful stuff or unsustainable stuff. They might have a bad reputation in the community. Like I said, they might be giving free care and pissing off all the local doctors. So as best as you can, you want to research that. Definitely good to do a scouting trip wherever you go, before you go, and do a lot of this background research, because you can't do that on the internet. Because most Haitians don't have email addresses. They're not on Facebook, and you can't just be like, oh, what do you think of this group? It's a little harder than that. India, any thoughts, India?
You talked about contacting local midwives and finding out how we can fill a need that's there.
Right.
Versus having a complete focus on volunteer base.
Good. Yeah, and we'll go over needs assessments in, I think, the fourth one. Because that's one thing we did before we went to Haiti. We did that scouting mission. We had a list of questions that we asked all the village leaders that we linked up with. We had like 8 interviews with different pastors and kind of people who knew people. Like, what are people getting sick from? What are they dying from? Where are women giving birth? How far away is the hospital? just that basic stuff to get a picture of what's going on, see how you can fit in. So with the births, it was eclampsia and hemorrhage being the two big things. Like, oh, well, one of those things is relatively easy. You teach people how to take blood pressures, and they can identify eclampsia. Better management of the placenta and giving Pitocin after birth when necessary, or actually the guidelines say to just do it anyway, prevents hemorrhage. So they're two easy interventions. You don't have to go, let's take these new people and make them midwives, and take who's already there, build them up. Interesting things, thoughts? Thailand.
I kind of updated them on what we talked about last week, I guess. But mostly, I think we were going to try to join up with people that were already established in Thailand to help just kind of coordinate the care.
Yeah.
And then I believe we had also talked about doing a combination between volunteers and people that were already there. So
Yeah, mix them up a little bit, some volunteers, some cool insights. No, health workers.
Oh.
You can do health workers.
Yeah, health workers, as far as volunteers, they already have, they're facilitating health workers in that area and empowering them to go around in their communities, or their different communities, to spread that knowledge and that education about sickle cell anemia. So it's kind of like we're going there, but we're not going to be there all the time, so we're empowering the community so that when we leave, they can be able to do it, help themselves.
Right, so the strength of education is it's information that keeps on giving even when you're not giving care. Good stuff. Okay. Again, we're just skirting over this stuff. So, mission statement. We don't really have time to watch that video, but there's a really good book called Made to Stick. And one of the guys who wrote it did a short video on writing mission statements that don't suck. That's the name of the video. And so he goes through what usually happens when organizations write a mission statement. And usually they'll start with something easy. Like his example was to make the best damn pizza in Maricopa County. That's actually a really good mission statement. But then you get people in committee, and then they're like, "Oh, we need to mention integrity," and then it's not just pizza. It's family entertainment, because we have this place, the pizza shop, and it's family entertainment, and then blah blah blah, and you end up with this really big thing that says nothing. By the time you let a lot of people add stuff onto it, mission statements are about brevity. So Invisible Children, everybody knows Invisible Children now because they had a huge controversy, and then their founder went crazy. He was naked in LA on the streets, and everybody heard about this, the Coney stuff? They're huge now because of that. I mean, it's not great press, but it's press. So their mission is to bring a permanent end to LRA atrocities. Lord's Republican Army, is that the name of it? Basically, it's a rebel group with child soldiers that's just slaughtering people in, shoot. It's been too long, I can't remember. He's a notorious bad guy. So basically, they're doing these big exposure campaigns, and they're supporting other groups that are trying to track this guy down and end it. Really simple, right? Rotary. So this is a little bit of a longer one, and NWB's is a little bit longer too. So to enable Rotarians to advance world understanding, goodwill, and peace through the improvement of health, the support of education, and the alleviation of poverty. Pretty good, huh? So, you guys are already 3/4 of the way to a mission statement. Probably whoever took notes last time might not be here, but we already kind of gave you the mission statement and your purpose, right? So, Lucci, it would be to alleviate the suffering of people with sickle cell anemia in Nigeria via education and treatment. Something like that, right? Pretty simple. And then anything you're doing that's kind of deviating from that, you'll have to revisit and say, we got to get back to the original mission, or we need to revise it a little bit. better to just come up with a good, solid mission, do a really good job at your niche, than branch out way too early. So let's briefly, we'll just kind of skip over that. And we're going to not do a vision statement either because it's a little more complicated. So a vision statement, I've had differing opinions from good nonprofit professionals on how much to talk about yourself versus kind of your vision for the world. So it's a little bit of like the flip side of the mission statement, which is kind of like what you're doing and your purpose, and the vision is kind of like your outcome. So, Feeding America, a hunger-free America. That's what they envision. And then the mission statement is something like to provide food to needy families, something like that, right? So veterans of foreign wars, ensure that veterans are respected for their service, always receive their earned entitlements, and are recognized for the sacrifices they and their loved ones have made on behalf of this great country. So it's a little more broad, it's a little more grandiose than the mission statement. Anyway, let's move on. You can read more about that online. There's just a lot of resources to doing that. So let's talk about building your team. So diversity is really essential, and the more you have early on, the easier it will be to start. NWB did not have this luxury. We didn't know a lot of people starting out who could provide these skills. So we kind of found them as they came along, and then we had a lot of knowledge that we tried to soak up in a short amount of time and evolve the organization. If you already have a pretty diverse group upon starting, it can make a lot of these things easier. So diversity in skills, having a lawyer or a paralegal or someone who can take care of that part of things can really help. Good at filling out forms, really organized, dotting their I's, crossing their T's. An accountant, you don't really need one to start up, but you will eventually want to have an accountant to handle your finances and an independent accountant to handle your taxes. It's just more transparency, looks better, less likely something's going to go wrong, just more eyes on your accounting. A nonprofit pro, there are various types. Some do a lot of marketing, some are like project managers, some are event fundraisers, some are development fundraisers who are more like building brochures and merchandise and making connections, etc. But most of these people know a bit about the other parts too, and just sitting down and talking to one of them for a few hours can give you a lot of insight, just picking their brains a bit. And then maybe you can invite them onto your board or just your advisory board. Business person can definitely help. A marketer, more and more a social marketer, someone who's really good with Facebook, Twitter, Pinterest, all that kind of stuff. That's Dr. Zinnia's job. She's doing a great job, and we're totally learning as we go, and we'll talk a bit about that later. A tech person, someone who can handle your website crashing, or who can kind of facilitate that other stuff, who has cameras, whatever it may be. Subject matter expert. So maybe you'll find someone who's like a PhD sickle cell anemia researcher, or like some kind of midwifery trainer or obstetrician for the midwifery project. Someone who knows a lot about that specific subject who can really help you get the technical details down. Maybe if you're doing health workers and you haven't done it before, talk to some public health people. Shadow with another group that's already doing it. Diversity of opinions is essential. Having a lot of yes men around you can lead you down some bad paths. It's good to have really analytical, just kind of argumentative people who are like, oh, we think this is a good idea. And they're like, I don't know about that. Have you thought about this? Like, oh, I guess it wasn't such a good idea. Or, yeah, I did. We need to like come up with a way to address that. It's good just to have those kind of oppositional people. Not to let them run your organization, but a lot of different brains, a lot of opinions. And also ethnicity. And I say this not in like a token manner, but you oftentimes, and Christian's really big on this, you oftentimes don't realize the cultural things that you have going on that other people don't share with you and vice versa. And you won't know until you run into it. And there is definitely, historically and currently, a big problem with rich white Americans going into poor country, Haiti, Mexico, Africa, whatever. I know Africa's not a country, just saying. Whatever. And trying to apply their brains in a situation that is a completely different cultural circumstance. So having advisors from that country advising your board, having an in-country board is not only really smart, it looks really good. It makes you more legitimate. People look for that kind of thing. Grantors look for that kind of thing. So really look into that. This is something that we're really trying to address in NWB now. Board members, so no, you might be asked to join a board. I know some students already have been for various organizations. Know that you have a legal responsibility to the organization, and if something happens, if someone does something bad, you are potentially liable for it. You also, with that, you have voting power in the organization. So you want to be careful who you put on your board. You don't want to put someone on your board just because they have one of these skills or because they're a good arguer. You need to have trustworthy people that you know on your board. And you need to really be working with them a lot before you're asking to put them on the board. Oftentimes board members will be good connectors to maybe you don't have all these skills on your board, but they know a lawyer they can ask questions from time to time. A little easier than having to pay someone like $500 every time you need to sit down with a lawyer. And then you have to be less careful with your advisory board because they don't actually have voting power, and they're people that aren't as involved as your board. They're not coming to the meetings, etc. But when you have a question or you need some help with something, they're there for you. So we'll do this very quickly. Literally in your groups, just kind of spout out from this list or any other skills you might need. Like the midwifery group, you're going to want midwives, even though you might have like some ND midwife people. I think it's really good to have some CPMs, maybe even some CNMs or OB opinions going on. So just spout out if you know people like this. You don't have to write them down, but just say like from your team, can you, your current little group, can you assemble a decent kind of board and advisory board? Go for it. And if not, where might you find one of those people? Just try to think next step. Everybody have like at least a few of these up. For my own selfish use, if anybody has anybody really useful and connected, let me know. So what had come up was a grant writer would be good, and I completely agree. And there's a difference between a grant writer and someone who's taken a grant writing class and thinks they can write grants. You want to ask if they've won grants before, how many, what's been the largest, the largest award, etc. So that'll be covered in the fundraising part. So, okay, you at least have gears going on kind of a team that you would build, right? So yeah, add grant writer on here. This is the boring part. Some people enjoy organizing things and writing neatly and putting colorful tabs and folders. You'll want to have them do this part just to make sure everything is really set. You want to have everybody look over it, make sure it's correct. So generally, this is the order that things go. There are some variations, like I actually put the 501c3 paperwork before bylaws because you don't need bylaws to become a 501c3 federally tax exempt organization, but that paperwork takes a long time. So the earlier you can do that and then set other stuff up in the meantime, the better. We applied for ours on August 29th of 2011. We were approved, I believe, early February or March. So it takes a while. But the nice thing is you can say you're pending, and oftentimes that'll help bring in some more donations because it's the the tax exemption for donations is retroactive to when you applied. So even though we weren't actually accepted until like February, we could give write-offs for donations before that. So federal EIN, which is your tax ID number, that enables you to then get a bank account and you could start doing things with money and not putting it on your personal taxes, which is not a good way to do things. Also, the IRS is following these applications a lot more closely because a lot of people with money are using this as a tax shelter. So there's some requirements on how many people you need on your board, conflict of interest. You need to have a conflict of interest policy, et cetera. Most of the people on your board need to be unpaid. Ideally, none of the people on your board are paid by the organization for legitimacy, but for IRS's purposes, majority need to be unpaid. So they'll probably find some things and then send you questions and ask for revisions, and that's fine. It's a process. It used to not be as stringent. Bylaws, you know, not my strong suit. Look it up. Try to find an example of some other organizations' bylaws. Pick and choose. Think about your organization, how you want to build it. Structure with your board. Are you going to have different chapters at student organizations? You know, it can get kind of complicated. So we're not really going to talk about it much. And then also your other state requirements. So we are actually incorporated in the state of Oregon. We didn't know this right away. No one told us that we also had to register with the Department of Justice, Department of Revenue, and then quarterly we need to tell them that we don't have any employees. And then we don't have to pay payroll taxes or anything. We don't have any employees. When we do, we'll still have to tell them quarterly that we have employees. So anyway, federal taxes are actually due May 15th. And you can get an extension on this. It's a month after personal taxes. I'm not sure why. So, like I said, have that arsenicum person manage. None of you you've had homeopathy, but no one else has. Arsenicum. Very organized people. Okay, we're going to roll into marketing, and we have like 10 minutes to do it. So I may cut out the little group thing on here too. So marketing is rapidly changing. There's a book I recommend that I didn't put on here because I just thought of it. It's called Social Media for Social Good. Something nonprofits. So that lady is brilliant. Like her full-time gig is looking at social media for nonprofits and doing consulting. She gives webinars. Some of them are free, some of them you have to pay for. She runs like a website and a blog, so take a look at her stuff. I can't remember her name, but we've learned a lot just from her free seminars, and we're getting the book too. So you want to have a logo and slogan. Get an artsy-fartsy person or a graphic designer to make a nice logo. You want to get it earlier the better in a vector format so that you can actually put it on things that are bigger than this, like bigger than a brochure. Otherwise, you're going to have to then find a graphic designer to fix your logo and put it in vector. And then another one to just try to get it all done early, even if you have to pay a friend like $50, $100, something like that. Make it nice and simple so you can, you know, maybe hand draw it or something, put it on different things. Thank you cards are amazing. This is a little more on the fundraising side, and there's a lot of overlap between marketing and fundraising, but try not to let them overlap too much. When you do thank you cards, hand write them. Even if you're getting really big, it's still worth it. Partners in Health does this, and they're kind of known for it. It puts a nice personal touch on it. If someone gave you a thing and then you went to Nigeria and you used the thing, take a picture of a kid holding the thing, put it on the thank you note. That is amazing. We've had supplement companies come up to us at AANP after they saw our booth. They're like, oh, we totally remember that thank you card you sent us. We're always going to support you. Don't get that in a typed out thing that you emailed, right? Yeah.
You know, they can also use that in the marketing too.
Yes. There's a local store in my hometown that from time to time gives us, it's like a health food store, gives us donations, and they have it up in their window.
Yeah.
Which, you know, it's just a touching thing, but definitely people are seeing it.
They can make brochures using that, showing
Yeah.
Good stuff. I mean, those pictures are worth 1,000 words,
Yes.
as they say. So
Yeah, pictures are valuable.
very valuable for fundraising.
Hmm. Definitely. I actually heard an idea, actually from someone who used to do some fundraising here, was that she would have kids make handprints on like a big piece of paper and then write thank you and send that to the donor. She said she'd go to an office of the donor, they'd have it on their wall. So it's not only like a touching thing and they're likely to donate more, but now their friends come in and they're like, what is that thing on your wall? And their friends have money too if they're big donors. So, you know, or they're well connected, or they're like, oh, that organization, it's kind of small, huh? Well, I know someone who can help them out. You never know who's going to come out of the woodwork. You got to be loud with your cause. Brochures, Vistaprint oftentimes has coupons that you can search for, and they're pretty cheap, and they're a pretty good job. They show up fast. That's what we've been using. But, you know, I got this brochure from when we did the garden pool build last week. It's Establishing Roots. They had a really fancy looking brochure, and it looked like it wasn't a whole lot to make. So we're going to look into that. But starting out, you don't want to waste your whole budget on this early marketing. You want to look good and professional, and you want to look a little bit bigger than you are, but you don't want to over-deliver on the marketing, and then they're like, so what are you doing? You're like, oh, we haven't started. You know, we've got like a year before we're going to do anything. And you just look dishonest. Nice website, clean, modern design. There are even free tools to do this pretty well now, like Wix.com is pretty decent. We are currently updating our website. We actually had a graphic designer who's an old friend offered to do this for us. So that's amazing. Social media, this can become a full-time job. We'll talk a little bit more about the high yield stuff. So Facebook, Twitter, LinkedIn, which I don't think is actually that great for nonprofits, but it's kind of a catch-22. Like, not a whole lot of nonprofits are doing much with it, so it's not much for nonprofits, you know. So maybe it'll grow, but I don't think it will. Pinterest is growing, Instagram, kind of. Having a blog is nice, and you know, probably in 6 months there'll be something else that's big. Who knows? Just having a tech-savvy, visual kind of person keep up on this can really help you out. Mailing list. The social media for social good lady, and I will back this up, says like, give me 1,000 mailing list signups over anything else. She'll take it over 1,000 Facebook likes, people following you on Pinterest, whatever. If you're able to get into people's email boxes voluntarily, only voluntarily, you will get a 20 to 30% open rate on your emails, no matter what you do. Don't expect a whole lot more. You'll have less of a click rate. There's some tools on MailChimp, which is really free and really easy to use. You could do up to like 2,000 people on your list before they start charging, which is great. Great tools. You could play with the layouts. You can like pre-test and send one version of your thing to half the people and one version to the other and see what got more clicks. Really nice web tools like that. Even Google Website Designer has that for websites. So merchandise is also kind of marketing and fundraiser. So you know, to be transparent about what we're doing, we have NWB t-shirts. And people want to wear the t-shirts because they're kind of nice. People like to work out in them because they're like this 50-50 blend. Apparently they breathe really well. That was totally by accident. I mean, no, we picked that blend knowing people would work out. No. But at the same time, every time someone wears one, people see that. And your name gets out. And maybe that person doesn't necessarily look at your website or your Facebook page, but at least the name is there. You know, there's that saying, people have to see something 7 times before they remember it, before it sticks. The more that people kind of see your name, the more closer you become to becoming a household name like Doctors Without Borders. So at the same time, you want to have margins on that so you actually do have some fundraising out of it. But we did a campaign, which I think I'm going to talk about a little bit later, called the To Heal campaign where people would wear the shirt doing something interesting that was not naturopathic medicine. We're trying to bust out of the profession and go bigger. So people doing anything but naturopathic medicine that was interesting and that had some kind of following, wear the shirt, post it on Facebook, tag them, and then you're now connected to that other little community. So take a look at our album, the To Heal album. We're still kind of doing them from time to time. So there's a lot of guerrilla marketing with merchandise too. Bracelets, super cheap too. Know your audience. Constantly collect data on what isn't working. So Facebook is really great for this. They have graphs. They tell you how many people have liked and shared posts, what time you posted them. You can quickly figure out the optimal things to be doing on Facebook. We actually did a 1-month trial where we on purpose did random things. We did pictures and videos and articles all at different times to try to figure out what was getting the best response. And so now we can reasonably predict how well a post is going to do and how well it's just getting people in the door to like our page. Like we share all those vegetable pictures and herbs that heal you and stuff like that. It's not exactly what we're doing, but it is generally what we're doing. It's bringing people in, and we're mixing that in with posts about what we're actually doing. Quick pearl, right now Facebook algorithms are totally geared toward pictures. You post a video, nobody will see it on a Facebook page. It's different. It's a whole different algorithm from what your friends are doing. You post a link, almost nobody will read it. Even if you have like 10,000 likes on Facebook, you might get 5 likes on an article, even if it's a good article. You put a picture up. We posted that picture of Batman. Anybody see that? He's like slapping Robin. Robin's like, I'm going to take antibiotics for my cold. And then Batman's like, it's a virus. We're like 170 shares on that. It's been our most viral picture yet. Imagine that. When you get a graphic designer, you can start putting your logo on things and start creating things that go viral too. That's kind of our next step. So tailor messages to each audience. Take a note on your different audiences. Look at who's sharing your posts. Engage those people. We found a blog that was sharing a ton of our food pictures, and they had 30,000 people behind their Facebook page. So we made a cooking show, or we're making a cooking show to pitch to them that they can then put, it's free content, easy for them to post. It's really branded toward us, really slick. Think about messaging that has engaged you. So think about the pictures that you've clicked on. Look at what your friends are kind of clicking on and sharing. That's the kind of stuff that people like to share versus like, oh, that's a nice picture. So you can read about how we're targeting. So yeah, as Joanna Hagen said, cannot beat visual. Pictures, videos. We're trying to get a new videographer to come down to Haiti. Quick stuff on audio-visual gadgets. Videos and pictures are not out of your budget, no matter what your budget is. You can get a $100 waterproof pocket video camera, just like this little guy, that takes decent video. Even today's smartphones, like the iPhones, take pretty good pictures and video. It's not totally pro quality, but it'll get you started. It'll take you places. Get a separate audio recorder if you're doing any kind of audio. That's more important than the quality of your video, by the way. Learn some editing, or better yet, just find someone else to do this for you. Unless you're the tech nerd in the organization, and then you're stuck with it, no matter what. Try film students. They need to build their portfolios. You've got ASU right here. Okay, quick going over the success algorithm. We're going to finish on time and not get Dr. Oskin mad. So this is from that book, Made to Stick, the success acronym. So first, your marketing messages that you're delivering. I'd already talked about last time the commander's intent, which is that your messages should get a point across. Within your organization, you should be getting across the purpose of the organization, like a mission statement should say what your organization wants to do and at the same time imply that it doesn't want to do a whole lot else. Your vision statement, how you want the world to look, you're moving in that direction. You want these to be simple. You don't want to throw in a lot of extraneous words in your messaging. You want to keep it really core. You need to exclude more than you're including, just like the mission statement. Think of like proverbial or statements that might go viral. versus really lengthy, complicated things. Unexpected. So think about, Super Bowl videos, the ads for Super Bowl are really like this. Because you're like watching, there's horses running. Like, what is this? You're trying to figure out what's going on, and it's something, they kick a football. Budweiser. Like, that's kind of weird. But I remember it years later, right? When did that video come out? Like 15 years ago or something ridiculous? I still remember it. You all know the Old Spice guy that's on the boat? Yeah, totally unrelated to deodorant, right? But it's really sticky. It was really unexpected. You're like going through this whole shot. You're just surprised at everything that's happening. So be really counterintuitive. Upset people's expectations. Concrete, really clear action, sensory things. Dissolve abstraction. Best way to do that is to tell stories, and we'll get to that. Credibility. This is a little harder. When you become a doctor and you have the letters behind your name and in front of your name, that kind of helps. But you want to have your message have built-in credibility. And there's an urge to just throw in a lot of numbers and statistics. That's not necessarily the way to go. Emotional. Feeling is caring. One person is more valuable than the group. There was an interesting study done of kind of a fake marketing campaign that talked about statistics in, I think it was Somalia or something like that. And there are all these starving kids, blah, blah, blah. And another one that literally just talked about this little girl in Somalia. And the amount of money that people in the study gave to the little girl was like 3 times as much as the drier passage about the group and all the people. Pick one person, tell their story. Blend with people's values. Really good examples in that book. I did a whole class at UCLA on this, just talking about all the different examples and ways that you can use this algorithm. So get that book made to stick. I'm cruising through it. So stories kind of encompass all of the above. You're going to tell a story, have a really simple thing, a core message to get out of it, and then a call to action at the end. And avoid what's called the curse of knowledge. And this is another reason why you want a lot of diversity in your organization. You are all nerdy ND students. Has anybody seen those like moving images, what we call med school, on Facebook? And so many of them are about, you're in med school now and you cannot normally interact with people. You may have noticed this. There was one that was posted today that was like, what happens when my non-med student friend hangs out with my med student friends, and it's from the Oscars, and it showed Tommy Lee Jones like the only one not laughing at Will Ferrell. It, like, you don't get other people because you've been in here too long, and other people don't necessarily get you. So you might be really excited about your cause, and you're going on about sickle cell anemia and blah, blah, blah. I don't know what that is. I don't know why I should care about it. If you're like, kids are dying of a genetic disease. Oh, or this little girl has these crises and she's in the hospital for weeks. If she gets malaria, she's going to die. Oh, that's what sickle cell anemia is. You need to have some outsiders look at your marketing stuff. So we are not going to actually build our first campaign because we're out of time. I'm sorry. Had to cram all this in, but you all have access to the PowerPoints. So think of pictures, videos, email. Here's a really cool link to guerrilla marketing stuff, 200 guerrilla marketing methods on that. Think about your core message. You want a specific, measurable, attainable, realistic, timely goal whenever you're doing a marketing campaign. You don't have to jump through all that for like every picture you put on Facebook, but if you're doing a campaign or you're doing a fundraiser or something, you want to have goals clearly delineated as to what they're going to do for you. Homework, read this thing on guerrilla marketing campaigns. These are really creative. Different companies putting things in cities and using sewer holes and other, just again, unexpected, simple, disrupting daily life kind of things. And then the other thing, since one of you found a conference, maybe all of you can try this. So what you've been doing in these sessions with talking about, you're kind of all talking about someone else's global health desires, but think about your own and just start talking to people about it. Talk to your mentors who might be naturopaths, they might be business people, whoever they are. Family, friends, colleagues, and then try to get outside of, again, the curse of knowledge, your other nerdy naturopathic friends, because they might be like, that's a great idea. They're terrible devil's advocates. You need to have supporters and some devil's advocates to keep you sane. And as well, I always welcome feedback. So thank you for coming, and I won't see you in 2 weeks, but Dr. Geyer will. 3 weeks. I'll be here for questions too.